Welcome to AfroNurse Academy, where we turn complex nursing courses into clear, simple lessons. This is the official breakdown of the NMC course curriculum. Whether you're preparing for licensure exams, facing semester tests, or just trying to understand what's ahead, knowing your roadmap is the first step to success. Quick tip before we start. If you're on a smartphone or tablet, flip to landscape mode. You'll see the course outlines, diagrams, and visuals much better that way. What you're about to see is the standard official curriculum approved by the Nursing and Midwifery Council. This is exactly what you need to master. Nothing extra, nothing missing. Now, looking at this outline, you might be thinking, that's a lot. And you're right. But here's where AfroNurse Academy is different. We're going to teach every single topic on this list, line by line, subject by subject. We'll break down each concept into simple, practical lectures that actually make sense. No confusing jargon, no information overload, just clear teaching that sticks. You don't have to figure this out alone. We've got you. So here's what you need to do right now. Hit that subscribe button, then tap the notification bell, because when we drop the next lecture in this series, you want to be the first to know. Grab your notebook, get comfortable, and let's master this course together. Your first real lecture starts now. Let's go.
Then we're breaking down the major groups: protozoa, bacteria, rickettsia, viruses, fungi. Each group has different characteristics, different ways they cause disease, and different ways we treat them. You can't treat a virus with antibiotics, for example, and understanding why will make you a better nurse. We'll also review the immune system because your body has its own defense mechanisms and you need to know how they work. We'll talk about how microbial infections actually happen, those routes of entry into the body, and the chain of infection, which is basically the pathway from source to susceptible host. And here's something practical. You'll learn how to take specimens properly. Because if you contaminate a urine sample or don't collect blood culture correctly, the lab results will be useless and your patient might get the wrong treatment. We'll also cover how to interpret common lab results, so when you see elevated white blood cells or a positive culture, you understand what that means for your patient.
Now, the second part, infection prevention. And this is where theory meets daily practice. Every single day you're on the wards, you'll be using these principles. We'll start with why infection prevention matters. And honestly, the statistics on healthcare-associated infections should be enough to convince you. This is your bread and butter. Hand hygiene comes first, and we'll drill this into you because it's the single most effective way to prevent infection spread. Hand washing technique, when to use alcohol rub, surgical hand scrub for procedures, all of it matters. Then protective clothing, knowing when to wear gloves, goggles, aprons, boots, gowns. It's not just about protecting yourself, it's about not carrying infection from one patient to another. We'll cover medical and surgical asepsis, that aseptic technique you'll use for wound care, catheterization, IV insertion. Understanding the difference between antiseptics and disinfectants, when to use each, how to use them correctly. Then there's processing instruments and linen, because reusable equipment needs to be properly sterilized or disinfected, and contaminated linen needs to be handled safely.
Housekeeping might sound basic, but there's a right way and a wrong way to sweep, mop, and dust in a healthcare setting. Do it wrong and you're just spreading pathogens around. And finally, waste disposal. Knowing the difference between contaminated and uncontaminated waste, how to dispose of sharps safely so nobody gets a needle stick injury. These aren't minor details. These are life-saving practices. In many African healthcare settings, resources can be limited, so we'll also talk about adapting these principles to your reality while maintaining safety standards. This course is about developing a mindset, an infection prevention mindset that becomes second nature. Because the moment you let your guard down, that's when infections spread. By the end of this course, you'll understand not just what to do, but why you're doing it. And that understanding will keep you, your colleagues, and your patients safe. Let's get into it.